this week we've been at our annual conference, Nursing at the Core of Cancer Care, and I was chairing a session on the evolving roles in the changing workforce. It was a really great session, very interactive, and we had 4 really good speakers. The first speaker was Martin Gallagher, and he talked about evaluating the educational needs of the advanced clinical nurse practitioners within a specialist cancer centre. And that was really interesting, really, and it's part of a bigger project, and he was just presenting the first phase. And they had 137 people as their sample group, and they got about 80 people who applied, and the findings were very interesting, really, that people felt most people had been qualified for quite a long time, more than 10 years, who were practicing at that level, but there was a range of roles and titles. There were some people who were working in management roles who weren't able to practice at that level at all due to the lack of clinical time and space they had to manage. But there was varying degrees of confidence levels within the groups, really. Some people felt very confident and practiced their advanced skills every day, and some people didn't really. So the main take-home things from Martin was that people feel needed to be supported even after they'd undertaken education and training for advanced roles, and that mentorship and some short, sharp update sessions would be really helpful. And then next was Helen O'Toole, and she talked about the programme that she'd implemented as the clinical lead for education within the trust that she worked in, looking at a programme for registered nurse associates and evaluating that at 6 months. And that was a really interesting project, really. Obviously, their nursing associates have been rolled out nationally. It's an apprenticeship scheme for nursing. But she really talked about how they struggled a bit to understand, and the registered practitioners within the ward areas where these associate nurses had attended really struggled to understand their scope of practice and challenges, and the importance of getting stakeholders really engaged at the beginning and explaining the project and making sure that everyone understood the scope and challenge. But a lot of these people were going to go on to be registered nurses once they'd undertaken this, and the programme had been evaluated really positively, and the fact that these nurses were on the register and understood their scope of practice really well, and had since developed extra skills due to the COVID crisis, and was really well evaluated. And it was a really good, interesting session. And then I had Kelly Gleeson, who was research nurse at Imperial College for CR UK, and she had about 10 years ago set up a cafe to get scientists and the public and health professionals working together, but hadn't evaluated it until fairly recently. And it was a really exciting and innovative talk that she did, really, about how getting lay people to understand what science does and perspective of science, but also some of the knock-on effects about how it had recruited into patient and public involvement and really increased that within the trust. And also that it had been really beneficial for junior researchers, people doing PhDs, etc., to actually use the cafe concept, which was a safe place where presentations were done and people were talking about their research and lay people were there, but to actually use those junior people using that to improve their communication skills in interacting with both healthcare professionals but also lay people as well. And that was a really interesting talk, and they've since COVID put it onto a virtual platform, but actually they want to go back to the face-to-face because the feedback from the patients and the lay people was that intimate space was really helpful. But I think it's a model that could be rolled out across different services, really, about that interface between science and patients, really, because I think it's been clear to me with the COVID pandemic and scientists on the telly and the government discussions that often people don't understand the science as much as we think they do, or what's happening behind the scenes to get the science from the bench to the bedside. So that was really good. And then I had Ella Hallpark, who was talking about a psychological support group she set up for teenagers and young adults, and really looking at that in terms of how that had developed, how that had worked with the different staff. And she's a youth support coordinator that's partially funded by charity and partially by the NHS. We talked about some of the challenges of that and that role. And also she discussed a technique called the beads of life that they'd use to actually tease out what's meaningful to some of the teenagers and how that works in practice. That was a really great breakout group to chair. It was very interactive. We had lots of questions and lots of discussion at the end. And the take-home message, I think, from that really was that nursing is quite complex. There's a lot of different roles within nursing, but also within healthcare generally. It's not linear, and there's lots of activities taking place, and it's quite interesting and exciting what innovations people will take and run with. And actually sometimes you don't always evaluate it or share it with other people. As Kelly was saying, it'd been going on for quite a long time, but they hadn't evaluated it. So that was great. And I think I really enjoyed it. And then later on, Professor Alison Leary spoke, and she was really good. And she talked about the plethora of roles and titles within nursing and how complex it is, that it's not a linear role, and it's a high-risk activity, and that nursing is a really safety-critical profession. So I really felt that linked in very well with the breakout session we did, because some of those discussions are what we had in that session really, so it really resonated with me.